Malnutrition has become a major concern for many countries around the world. The rights of children to be well looked after and fed has not been recognized by governments. Papua New Guinea is no exception. Among other diseases, malnutrition rate is high, particularly for unfortunate parents and those living in rural areas. The national nutrition policy has been neglected by successive governments. This has resulted in a 3-day workshop held in Port Moresby. The National Department of Health, National Planning, UNICEF and other non-government organizations attended the forum. The objective of the forum is to draw up a strategic plan for the National Nutrition Policy 2016 to 2012. According to UNICEF, the rights of children is yet to be recognized in terms of nutrition and health. Specifically, it talks about the right to good nutrition. However, in Papua New Guinea, almost half of the children are malnourished, with many under 5 years old, undersized or stunted. Key determination of child undernutrition in PNG includes suboptimal maternal nutrition and are immune to diseases such as diarrhea and malaria, among others. Not only malnutrition poses a threat to the survival of 500,000 children in PNG, it also threatens a sustainable economic growth. Hence, it leads to a very costly exercise and low productivity, costing the economy about 1.5 billion Kina per annum.
Economic analysis we've done with Frontier Economics estimates what that cost is of lost productivity through death and through impairment, and then calculates that at the national level, and it's a staggering $1.5 billion in a single year, representing 8.45% of PNG's gross domestic product.
But working in unity to address the issue is important for all stakeholders concerned, in terms of informing parents, especially mothers throughout the country, on how to prevent malnutrition. Adequate information is vital to help mothers.
Sadly, they lack some knowledge around what that looks like. Many are giving their children food other than breast milk when their babies are too young, and they're doing it because they think that it will make the baby healthy and strong, but in fact it can actually make the child vulnerable to disease. And so I saw some children being given 4 days after they were born fish soup, which was prepared using water containing contaminants from the environment.
The outcome of the workshop will see the establishment of an action plan to address malnutrition in PNG.